Good morning. Welcome back to Open Med School. Today I am going to discuss with you the major cardiac symptoms. So, an approach to cardiac disease starts with history taking and cardiac physical examination and necessary investigations. So, cardiac history is very important. Physical examination and necessary investigations depending upon the history and the examination findings. Now we go into the method of history taking. A good history should be concise and it should cover all important points. So concise history and cover all the important points. We look into how to take the history. As we know, a proper consent should be there and appropriate greeting of the patient, identification of the patient, hand sanitation, etc. should be done before taking the history and physical examination. So proper positioning of the patient, ideally you should be standing or sitting on the right side of the patient. Whenever you are examining a patient of your opposite gender, there should be a chaperone or a bystander who is a relative of the patient or a hospital attendant. The rules: the patient should be allowed to tell his history in his own words. That is very important. So don't try to change the history by your medical knowledge, and leading question should be avoided as far as possible. What do you mean by leading questions? If you ask somebody, have you got chest pain? That is a leading question. That is, you are going to get an yes or no answer. Such questions should not be there as far as possible. And questions should be asked when you think that the history given is inadequate and patients have some vague points and there are certain gaps in the history. Then you may ask, depending upon the situation, a few leading questions also. As mentioned, as far as possible, the questions should be indirect, neutral questions. And the yes or no answer questions like have you got chest pain, have you got breathlessness should be avoided as far as possible. Now, before going to the history taking, you should see the name, age, sex. The biodata should be confirmed. If it is an OP ticket or an IP ticket, should verify with at least two things: name, phone number, Aadhaar number, IP number, or address, something like that. So that because many patients can have similar name in the OP and IP data. Then the presenting complaint. Presenting complaint is the complaint for which the patient came. Avoid the tendency to include all the symptoms in the presenting complaint. The patient has come with chest pain, that is a chest complaint. There may be associated vomiting, etc. or some associated symptoms you can mention in the rest of the history. The complaint, ask the patient why you came, what is your main problem, and that is a thing that you should include as the presenting complaint. Then go into the details of the presenting complaint. That is a history of presenting complaint. I have already discussed on the basis of OPQRSTA. The major complaint should be analyzed in the 7-dimensional pattern, and all of you please go and read that chapter on history taking OPQRSTA format. At the end of the history taking, the history should contain minimum the duration, the mode of onset, mentioned as acute, subacute or chronic, the sequence of events, whether it's a progressive disease, regressive disease or recurrent disease. For example, somebody with chest pain. Chest pain can be progressive, that is initially the pain may be lasting 5 minutes, later it is increasing, another episode maybe 10 minutes. So it means that it's a progressive complaints are there. Second is it is recurrent or not. For example, somebody has got angina, they can have recurrent chest pain. So this should be mentioned. Always think about additional symptoms. For example, somebody with a chest pain, they can later develop breathlessness, they can develop syncope, they can develop PL edema. So that is what is called additional symptomatology. Major cardiac symptoms should be asked for. Treatment received and the response can also be included in the details of the presenting complaint. And as mentioned, you have to analyze on the OPQRSTA STA format or Socrates format. That is for any symptom you should do like that. Hope this point is clear. Then coming to the past history. In a cardiac patient, you should ask about childhood diseases, because some of the diseases can be congenital heart disease. Always in the past history include the drug therapy rather than telling patient is taking treatment for hypertension. You mention which medicine, how much is the dose, because your aim is to treat the patient. Include prior illnesses, that is cardiac and non-cardiac diseases, any operations patient has undergone, any trauma. Always include a recent dental work. What is the importance of dental work? Because infective endocarditis can occur following a dental procedure. That is why you should ask about that also. And nowadays, CABG, there is a percutaneous coronary angiography or interventions, angiography, etc. are very common. So always include the prior cardiac procedure. Additionally, ask the patient whether they have undergone any cardiac procedure. So that is regarding the past history. In addition to this, in the past history should include the major cardiac risk factors, because we know that coronary disease is one of the major diseases of mortality and morbidity, and you should think about the risk factors for coronary disease, especially the modifiable risk factors. They are the cigarette smoking, history of hypertension, dyslipidemia, family history of CAD, that is a premature CAD. That is, suppose somebody has died of myocardial infarction at the age of 70, that is not a major risk factor. But suppose in the family there is a premature CAD, that is before 55 years for the males and 60 years for females, think about there is a high risk. And again think about diabetes mellitus. Okay, hope these are the things you should include in the past history. In addition to the common diseases, just like in any other system, you should add whether there is history of asthma, tuberculosis, etc. should also be asked about. Then coming to the family history, in the family we are concerned with some hereditary factors, exposure to some etiological substance. So you should ask about any family history of all the disease. You can use the mnemonic MJ threads. It includes the major. This can be used for the past history also: myocardial infarction, jaundice, tuberculosis, hypertension, renal disease, epilepsy, asthma, diabetes, stroke, something like that you can have. This can be asked in the past history and also in the family history. Hope this point is clear to you. So you take and draw a family tree if it is required. Then coming to the social and occupational history, it is not the bowel and bladder. You should ask about the high risk factors, which already we have mentioned: smoking, physical activity, any addictions, that is under sexual exposure or exposure to sexually transmitted diseases. That is again important. That is and include the social support system, what is the patient's family background, house, and environmental factors can also be asked for. Then finally comes the review systems. Review systems is symptoms which you are not covered during the present complaint or past history. For example, a patient with a cardiac disease can have respiratory problem like wheezing, or they can have neurological problem like headache, migraine. So that is what is called. So review systems is symptom analysis. It is not examination. Symptoms related to other systems. It can include some few general questions like weight loss, change in appetite. Then each system you ask the major symptoms. Then you may think about the ideas, concerns, and expectations of the patient. This also you keep it, and finally you summarize what you have obtained so far and confirm that this is the version of the patient. So you can tell the patient, okay, you are having this much, so these are the major symptoms, or this is the history I obtained, and confirm that there is no other problems are there for the patient. In the next session, we'll be discussing about the symptoms related to cardiac disorders. Hope it was useful to you. Thank you.